When I speak to general audiences, people often say, "That will never happen to me. I have good insurance. They paid for my knee replacement. They never give me any trouble." And I say, all insurance is very, very good until you need something they don't want to pay for. In 1970, the average lifetime medical expenses for one person were about $2 million. Those same medical treatments today would cost approximately $38 million. No insurer, no employer, no government entity can afford to spend $38 million on you. It doesn't add up. They'd go broke. So your insurer has to find many different ways of not paying for the medical treatments that you need. So what's the good news about insurance denials? They can be overcome quickly and decisively. However, in order to win these battles, we need to know one thing. When your insurer says it's not a covered benefit, it's not in your contract, it's not medically necessary, that's not the law. It didn't come down to Moses on the mountaintop. It's just what they say. In 2011, Debbie from Long Island contacted me about an appeal. Her son Robbie had had his life-saving brain surgery 2 years before. The insurance company had denied it. They had mortgaged their house to pay for it. I said, check your certificate of coverage and see how long they give you to file an appeal. She said, oh no, it's over. They only give us 12 months to file. It's been 2 years since the surgery. I said, so what? That's just what they say. We did an appeal. We won it in 5 days. In March 2005, I was diagnosed with late-stage appendix cancer, rushed into surgery, and given months to live. Because I had an unusual cancer, I had the great privilege of being sent to the chief of oncology. I sat there. I said, well, I have appendix cancer. What's the treatment for that? He said, there is no treatment for your disease. And even if there were, they wouldn't pay for it. In that moment, I thought, oh yeah, that's just what you say. It didn't take me long to find the tried and proven treatment for our disease. You know, cytoreductive surgery and HIPEC. It's just that it was out of network. And so my insurance company denied it. I had no out-of-network benefit. Was that going to stop me? Was I going to die because my insurance company didn't want to pay for it? No. People said, oh, you must have had a burning desire to live. And I said, no, I had a burning desire not to look like the world's biggest chump. For 2 months, I read, studied, gathered proof. Then I wrote my appeal. Nobody thought that I would win. 3 days after receiving my 23-page war documents, the insurance company called me. Well, we decided to pay. In October 2005, I traveled all the way across the country for a 14-hour cytoreductive surgery in HIPEC. I hit the jackpot of complications and spent 43 days in the hospital. My entire bill came to $347,000. I had the cheesiest, catastrophic, individual policy with a $6,000 deductible and a $16,000 out-of-pocket limit. I must have scared them pretty badly because they paid it all. Deductible, out-of-pocket. My total out-of-pocket expenditures for 2005 was $9. And that's because I asked for a glass of juice in the hospital. It wasn't long before other patients started to find me and asked me to write their appeals. This became my work. I just won appeal number 158. All different insurers, all over the country, all different illnesses and conditions, all for treatments costing between $100,000 and $1 million. All won in a week or less. When it comes to insurance, everything is negotiable, but only if you ignore what they say. People are walking for the cure. People are running for the cure. People are donating for the cure. This is a good thing. However, when the cure for appendix cancer is found, it's going to be very, very expensive. Your doctor will order it, and your insurance company will deny it. What are you going to do? No, you're not going to call me. You're going to write an appeal. And you're very likely to win it if you'll just remember three things. Number one, you are the only person who has any power over your insurance company. Number two, the insurance company is not your friend. Number three, the most important thing about any appeal is who you send it to. When medical treatment is denied, everyone assumes that there's someone bigger, fluffier, and more powerful than we are who's supposed to handle this for them. Isn't somebody else supposed to win my appeal? First, people bring their insurance denial to the doctor's office. The doctor will win my appeal. Back in 1960, your doctor was completely independent of the insurance company. He was ideally positioned to fight your appeal. Times have changed. They changed a long time ago. In about 1970, the insurance companies got together and they said, how can we get control over all these doctors? We need to make them stop ordering all these expensive tests and treatments. They came up with the most diabolical instrument of control that you can imagine. It's the dreaded networks. For the past 40 years, when your doctor completes his medical education and comes out to practice in the world, one of the first things he does is to sign contracts with all the major insurance companies. He is now in network, and he can take your insurance card. In other words, he's bound by contract to the insurance company. The insurance company gets to say what treatments they're going to pay for, when they're going to pay, how much they're going to pay. If they decide to cancel his contracts, he won't have any patients. Is he ideally positioned to fight the insurance company? Doctors cannot fight these battles for us anymore. And besides which, they have more important things to do, like save our lives. The doctor isn't going to win your appeal. Next, people turn to the legal profession. A lawyer will win my appeal. Good luck finding a lawyer to take your denial of care case. Why? There's no money in it. But first of all, the insurance companies have the insurance, or they have the legal thing covered. They have 100 high-powered lawyers to your one lawyer. They will keep you in the courts for years. Number two, no money in it. If you win a denial of care case, all you get is what they should have paid for it in the first place. There are no damages. Who's going to pay your lawyer for working for years? Number three, the legal system does not work fast enough for us. When life-saving treatment is denied, We need treatment next week, not next year. The lawyer is not going to win your appeal. When all else fails, people say, the insurance commissioner will win my appeal. It's not the insurance commissioner's job to fight the insurance companies. As a matter of fact, he probably just worked for an insurance company. The insurance commissioner's job is to be knowledgeable about the insurance laws and regulations in your state and to tell you how to get insurance coverage in your state. Period. The insurance commissioner isn't going to win your appeal. You are the only one who has any power over your insurance company. To an insurance company, every denial of care is a contractual dispute. They don't care if you need the treatment. They don't care if your doctor says you need the treatment. They don't care if it's the only treatment that will save your life. There is only one question that the insurer cares about when deciding whether to pay or not. Are we required to pay for this per the terms of your contract? You are the one who holds the contract. You are the one who gets to say. Now, the insurance company certainly isn't going to help you win your appeal. As a matter of fact, if you do what the insurance company says, you're going to. Why? Because insurance company words usually mean exactly the opposite of what they appear to mean. It's all propaganda, all the time. It begins with the name of insurance companies. Blue Cross and Blue Shield. My insurance is my cross and my shield. It sounds like a religious campaign. Like Joan of Arc is going to ride out in front of the troops and defend you. How about United Healthcare? We're united. We have health. We care. And the winner of the shameful insurance propaganda award, Golden Rule Insurance. Golden Rule Insurance. Do unto others as you would have them do unto you. How would they like it if you denied their brain surgery? The insurance company certainly is not going to help you win your appeal. In order to win an appeal, we need to do exactly the opposite of what they. I'll give you one example. The post office box. Why is every appeals department of every insurance company always a post office box? Because a post office box has no name. You can't call a post office box on the... You can't march up and down in front of a post office box with a sign. There's no accountability. If you only send your appeal to the post office box, you just stuffed your appeal in a bottle and threw it in the ocean. So what's the opposite of that? I spend 1 to 2 days building an organization chart of the insurance plan. I find the names and titles of the highest level executives at the insurer and at the employer. Then I stay up very late at night, Googling like crazy, until I find their personal phone numbers and their personal email addresses. We fax and email to 14 of them simultaneously. And the next morning, I put my helpie on the phone. I coach them. Hi, John Smith here. Just calling to see if you've received my urgent expedited appeal. You have? Great. How's it coming along? Tell me, when can we expect a decision on that? And we keep calling until we have our decision. We usually fax and email on the Sunday night, and we have a decision by Tuesday noon. There's nothing an insurance company hates more than having us calling their executives all day long. And the fastest way to get rid of us is to pay for it. An insurance appeal is a strategy game. The best way to win a strategy game against a bureaucracy is to know who's in charge and to go straight to the top. How many here have insurance through their employer? Wow, many of you. Well, in 2015, about 85% of employer plans are self-funded plans. Who knows what self-funded means? We'll see if you're right. In a self-funded plan, the insurer is not insuring you anymore. They're not paying for your medical treatments. Who's paying for every broken leg, every blood test, every surgery? It's your employer. They're paying for these out of their checking account, as it were. So because the employer is financially at risk in a self-funded plan, they are the final decision makers on all your medical treatments. Congratulations, your employer gets to decide if your child gets brain surgery. If you fight your appeal up the food chain of the insurer and ignore the employer, you are barking up the wrong tree. Does your employer have you convinced that the insurance company's in charge? That's just what they say. We've come a long way in the past 10 years. HIPEC is hardly ever denied as experimental for appendix cancer anymore. So what are our major insurance issues today? Number one, crazy expensive drugs, such as Avastin, Zaltrap, Erbitux. These drugs can cost $20,000, $30,000, $60,000 a month. They are officially approved for colon cancer, not appendix cancer. So if the insurance company decides to tighten the screws, they'll just deny it as experimental for your diagnosis. However, this is not the biggest insurance issue for us. That would be the dreaded networks. Cytoreductive surgery can be as complex as separating conjoined twins. Our survival depends upon us getting to the right surgeon. More and more often, the most qualified and experienced surgeons for this are finding themselves out of network for our insurance plans. We are brainwashed into believing that we have to go where they take our insurance card. It's not true. I've been winning in-network, out-of-network appeals for 10 years, beginning with my own. No insurance company gets to dictate where we go for surgery. They don't get to say. In December 2014, I fought my first case for one of Dr. Laurie's patients. I got the call from a young woman named Mira on Christmas Eve, 2014. Mira wanted me to do an appeal for her husband who had colon cancer. This case had everything against it. First of all, they were not calling me before the surgery. They were calling me during the surgery. Rob was in the OR even as we spoke. Number two, they had an HMO in Utah. Never in the history of the universe had this HMO ever agreed to pay for any treatment outside of the state of Utah. Number three, her husband had the great misfortune of working for the parent company of the HMO. The insurer was also his employer. And finally, Mira was the sole caregiver for her husband. While she was furiously fighting the appeal with me, making the phone calls, doing this and that, she would be sleeping on the floor of the hospital room and tending to Rob's medical needs. I said, Mira, this is an impossible case. I cannot, in good conscience, take a case that I can't win. I turned her down. She called me back the next day, Christmas Day. She said, I am determined to make them pay for this. You know, Mira, this case of yours is not a winner. I would not go into it with my usual confidence. However, if you want me to fight this case, I will. It was a wild ride. It took us 8 days to win the appeal. Mira and I became friends, as often happens Because this is not about insurance. It's about life. It's about taking charge when you feel the most victimized. It's about winning great victories when life suddenly spins out of control. It's about dignity. It's about grace. It's about winning a strategy game with the highest possible stakes and then helping others to do the same. In every one of my 158 cases, the insurance plan was determined not to pay for it. If I had believed them, I wouldn't have won any of them. However, I knew that that's just what and that what we say is more truthful, more factual, more eloquent, and far more powerful than anything that they could ever say. Thank you.
Thank you, Laurie. That was inspiring. Do people have questions?
What's the essence of the argument that you make so consistently and so apparently effectively?
Well, nowadays these appeals are about 52 pages long. Any more than that is too long. But I don't make one argument, I make a dozen arguments. Because I don't work there. I don't know what it is that turns the tide on that one. I prove that they've paid for it 20 or 30 times before. I prove that I read all the scientific articles and update them constantly, and then I quote them in the appeal, because they're not going to read a scientific article. And I quote them in the appeal. I think I prove that the treatment that they've gotten thus far has been substandard, and that embarrasses them. But I think what really sells these is the story. You know, people ask, are you a lawyer? Do you take a legal approach to this? I say, no, I have a master's degree in French literature. I take a literary approach to these things. One of the first things I do is I get my helpee on the phone and I interview them for an hour and get their bad medical story. People do not understand that they'll complain to me or complain to their family about all the bad things they're in, but you have to put it in the appeal. Without any emotion, no blame, purge all emotion. Just tell it. Tell how they cut off the wrong foot. Tell about how you got the wrong surgery, you got misdiagnosed, they misread your scans, and they get to the end of reading this, and they say, we kind of screwed up. I think we just need to let them go wherever they want to. But I think the most important thing is the cover page, because many people who read it will only read the first page. So on the front page are all the people I'm sending it to. Beautiful first page. And people don't find these folks, you know, and so they think, does she work here? Is she a scientist? Is she a doctor? Is she a lawyer and a doctor and a scientist? And so I want them to look at that first page and start calling each other. Joe, did you see this? I've never seen anything like this. It's like the synergistic effect. So who you send it to really is the most important.
What's your experience with Medicare?
Well, I don't do appeals for Medicare at this point, simply because I can win an appeal against a private insurer in a few days, but Medicare appeals take longer. It could take a month or 2 months, and I can't afford to spend 2 months, even emotionally, on one case, but you can. Medicare is very appealable. They have an appeals process, and you can win. Yes? Oh, all the time. Every in-network appeal. They have in-network surgeons that they would like to send you to in Kansas City or Milwaukee, Wisconsin, or wherever they are. So how do I deal with that? I've got it down to kind of a science. First of all, I make them go in there and consult with that surgeon. Because if you don't at least consult with them, they're going to say, why should we allow you to go to Dr. Laurie? You didn't even bother to go see our guy. But I send them in with a list of questions. And the questions are the things I need to know to sort of, how shall I say this nicely, kind of throw a little mud on them in the appeal. Because one of the biggest points to prove in one of these appeals is that the in-network surgeon either does not offer the requested treatment or is not qualified to offer the requested treatment. So I prove that I go into the PubMed database of scientific articles, and I see that he published 3 articles, one about malpractice, one about mice, and one about esophageal cancer. So I say, clearly this is not his main interest. I have him go in, they ask how many he did, but that's not the most important. I ask, how is that one patient doing? And then I tell the story. I tell the story of the visit. So the science, the experience, is he even offering HIPEC? You have to I have to say, you have to sort of discredit that in-network surgeon, or the list of surgeons. And then you prove that Dr. Laurie walks on water. And it's a little compare and contrast. Yeah. Oh, yeah. It's very labor intensive. Because as everyone knows, there's some serious HIPAA laws. You're not to ask your doctor about other patients because you can't do that. So what I do and what I did, this all kind of evolved from my own appeal, because I sort of invented this wheel. I go out on the patient groups. You go to your patient group and put out the call. Say, Cigna will not pay for my Avastin or my whatever, my deny this or that. And you say, do you have Cigna? Did they pay for you? And you start building a precedent list. Now, not many people follow these groups in current time. So if there's a search feature on a patient group, online patient group, you go in and search for mention of Aetna, denial, approval. I've been building a precedent list for cytoreductive surgery and HIPEC for 10 years. Nobody asked me to do that. I found these people in newspaper articles and contacted them off the groups, my own helpies. I now have 247 cases where insurance companies have paid out of network. Kaiser, Aetna, Blue Crosses and Blue Shields up the yin-yang. They hate it. We get all the best, most powerful information we get, including precedent, it comes from our fellow patients. Yeah. Yes? Well, that's unusual in this day and age. Because usually what the insurance company does with expert docs is they say, oh, you get to have a peer review with our quote-unquote medical director. And one time I said to Dr. Sugarbaker, actually, I said, if you're talking to a medical director, you just got the bum's rush. Because they give them, remember how the words mean the opposite? A medical director is a peon at these places. They don't even have decision-making ability for the most part. So you kind of got lucky there, I believe. Well, no, I mean, for us, I used to belong to a group on Yahoo for appendix cancer. That sort of got old school. Now there's a large group that you belong to on Facebook. Well, you know what? Insurance companies go to great lengths to hide the contact information of their executives. As a matter of fact, I'm sure they have whole departments dedicated to purging their contact. 8 years ago, I could find all these juicy lists with email addresses. No more. That's a sport. That's part of the fun. I could write a whole book about how to find them. They're really Googling skills. First of all, if they may even have a leadership team on their actual website. So I start there. I'm looking for chief medical officers because they're boss over all those medical directors. I'm looking for the CEO because he's at the top. I only go executive vice president and above. Then once I get their names, I start Googling like their name and then just say the word phone. Joe Smith phone. Sometimes it pops up. Joe Smith, and if all their email addresses are configured the same way in a company. I don't know why they make this so easy for me. So how do you find an email address, like first name, last name? They all do them the same. So I go to the press releases on the insurance company's website where they're bragging about themselves, and the media director always shares his email address. And so then I got the presidents and all the vice presidents' names, and I send test emails to all of them. And if it goes through, then I've got their email address. It's a long story, but it's a great sport, and it really is fun to do late at night.
Okay, thank you.
Thank you.
Well, we have...